Hello. I've had some great adventures over the last year, going around the country, speaking at different events and meeting amazing people all over the place. One of the people that caught me was at the Smiles at Sea Dental Festival event last year. His name is Layne Martin. So Layne got up on stage at the Smiles at Sea and he shared this amazing story with me and the other folks that were in there in regards to this transformation that he's done in his life, the transformation that he's done in his practice and in his pursuit for how he's trying to make a difference in dentistry. His passion, it was absolutely amazing from stage. I was so engaged with him, not because of what he had to say, but because of the way he said it. Like I knew that he wanted to share it with everybody. And the cool thing is that it was videotaped, but it was recorded and then it was blasted out on social media and Facebook and all those different things that we use. And so he was not just talking to the folks in the room, he was talking beyond the people in the room. And the impact of what they've got going on for Airway is absolutely amazing. You got Dr. Michael Gelb, you've got Jennifer Kirkham, you've got Layne, who I've built an amazing relationship, Layne Martin. And so the next 30 or 35 minutes, I'm going to let Layne and I just talk about what it is that they're up to and how they're making a difference, and not just in the difference in people's practices, but the people that they impact. And the cool thing about it, it's just a couple of guys talking to you about how we love to help people help people. And that's the impact and the ripple effect that we're creating in dentistry. So here we go. Okay, good morning. How you doing, Layne?
I'm great, man. Thanks for having me.
Yeah, so I had this idea 2 weeks ago. I was just thinking, I was out running and biking and doing all the stuff I like to do, and I get my creative thoughts there. And I'm like, man, all these good people that I've had the opportunity to meet and talk to over the last year, through like Dental Festival and different things, they all have a unique thing that they do. And with that unique thing, they're super passionate about sharing it. And I'm attracted to passionate people. So somebody might have something that's really good, but I tend to turn them off if they're not passionate about what they're sharing about. And all I can tell you is that you from stage had me mesmerized by the way that you were talking, the passionate feeling that you had, the heart that you were talking about it. I think you even got choked up a little bit when you started talking about the impact of not knowing what you needed to know, but now you do know what you need to know to move forward. So I want to introduce everybody to Layne, and we're just going to talk like two guys in a coffee house, but miles and miles away. So to learn more about what you do, what your passion is, maybe some past experiences, what brought you to this point, and then what are some next steps that people can take in order to learn more about what you do and how you can help. So let's go ahead and start. So let's go.
So first of all, I really appreciate you having me. Second of all, everything happens for a reason. And, I've never been on stage. That was the first time I was on stage, was at Smiles at Sea. And you were sitting in the front row, and having you in the front row, I remember it's interesting. I'm going to talk back at Smiles at Sea, and my talk is on my experience there. It has nothing to do with my program, but I gave my mic back and I walked right up to you and I said, you got me through that whole talk. And then I remember you saying, listen, you were genuine, and that was great. And I was terrified. And you then introduced me to Bo Eason, and then I went to Bo, and then that took me to a whole other level. So it's been a spiral of, I had an idea. I kind of am passionate about this. I sold my dental practice to go into orthodontics to help people with snoring and sleep apnea. But you've taken me on a kind of a different path, and now it's getting our message out there even better. So I really can't thank you enough for kind of setting me on a journey and getting me to a point where now I'm a lot more comfortable getting on stage. I'm still terrified, but it's like sports, right? You're an athlete. I used to get butterflies in my stomach before soccer and hockey. It's the same thing, but now it's more like, all right, it's passion for our audience. So I really can't thank you enough. Everywhere I go and I talk, I actually mention your name because you've kind of set me on a really amazing path. And I really am so grateful.
I appreciate that, man. That's really cool to hear that. Thank you. So,
Yeah.
so where are you at now? So tell me what's going on. And like, how did you develop this passion? Because again, it was in you like fire, and that's what you were given that day, and that's what you've given since. So tell me where that fire comes from.
Yeah. So, I had a restorative dental practice in Manhattan. I trained with Larry Rosenthal. I taught out at Coyce, and I was in a study group and with some amazing dentists. And one of the dentists in the group, every time we would discuss a complex case, he would be like, all right, airway problem. Next case, airway problem. And I'm like, dude, this is bullshit. I just want to do my veneers and crowns. After the 50th time, and it's my friend Victor Avis, I love him to death. I'm like, all right, tell me about this stupid airway thing. And next thing I know, I'm doing an airway residency. And I realized that the things that I was seeing every day in my dental practice, so broken teeth, wear, anterior wear, they were all signs of a bigger problem. Because in medicine and dentistry, we fix symptoms, right? I fixed symptoms for 15 years, and I was spinning my wheels. And I would do dentistry at the highest level, Anthony, and things were still breaking. And I remember walking home from work one day. I was on Madison Avenue and 60th Street, and I just broke down in tears. I'm like, all right, I don't know what to do. Things are breaking. Long story short, I sell my dental practice and I go into ortho. And now I have this passion of, all right, we have a gift as dentists, right? I have a gift, you have a gift. But as a dentist, we had a gift to really make people look better and feel better. And now, you know what? I have a gift that I could save someone's life, or really not only save someone's life, but mitigate their symptoms of snoring and sleep apnea and just feeling crappy. The bottom line is I went into ortho because I was like, I want to fix the problem. In kids, I could fix the problem in kids. But in adults, it's an incurable disease. But what I could do is I could help someone feel better and sleep better and perform better. And that's kind of our brand. So I've created a mouthpiece with Jen Kirkham and Michael Gelb. And then also we have this awesome pillow that, people love. So it's almost like a system. I kind of felt like it was two startups, but really, I guess they're one and the same. And we're getting really great results. So I don't want to, I want the dentists on board. Obviously, it's going to take a paradigm shift to get them to think, all right, let's not think only about teeth, but let's think about their airway. And the thing that I always say is your teeth should touch for only 15, 20 minutes a day. You have to breathe for 1,440 minutes, right?
Yeah.
So that's kind of where I'm at. Yeah, I'm passionate about it, but I love surrounding myself with great people and people like you and Jen and Michael. I've been so fortunate to be around that.
That's awesome. So there was a story that you had shared with what ignited that passion. And it was a story about a friend that you have. And so talk to me about that a little bit and why it's so impactful. And the reason why I want you to share that is because in my life, with some other things that I do, I have a friend that almost died of a stroke because he took a pre-workout that was full of amphetamines. And so when I'm sharing about even more about what I do on the health and nutrition side of what I do, I make sure to share that story because I get fired up because somebody took a designer pre-workout drug that then almost killed my friend through a stroke. So I'm very passionate when I speak about it. And I want you to share that same passion because I've seen it. I've seen that spark when you've ignited it.
Yeah. So at Smiles at Sea, I started my talk saying, imagine getting a call that your 40-year-old patient and friend died. So I got that call a year ago. I was jogging on the beach in Florida. My friend called, said, did you hear what happened to Dave? And I said, no. And he said, Dave died. And I was like, what are you talking about? And Dave is 40. He was 40. So when Dave presented to my office, he had high blood pressure, acid reflux, he snored, but he had broken teeth. And he had a collapsed vertical. And at the time, I restored his teeth and I restored his vertical. I treated his symptoms and I missed this problem. Mm-hmm. And he died from the comorbidities of sleep apnea. Mm. And, I knew he kind of had a problem. And I was like, all right, he's clenching and grinding. So that was something that really kind of set me on a different path. Yeah. The other person the same story. I got a call probably when I was starting my ortho program. A buddy of mine, patient, Ron, 55, died of heart failure. So he had the same symptoms as Dave. He snored, high blood pressure, acid reflux, broken teeth, severe wear. The difference between Ron and Dave was, at that time, I was already trained in airway. So I knew Ron had sleep apnea. I saw it. I saw it when I treated him.
Yeah.
And I told him to go get a sleep test, Anthony, and he never went. And he's gone. And if it happened in my office, it's happening in every single damn dental office. And that's really the message. Listen, you don't know what you don't know. I get that. I didn't know. But once I knew, I couldn't unsee it. Now, the problem is when I told Ron to go get a sleep test, he never went. So what we've done with Jen and Michael, we've created a system. The way I equate it is we've created the Invisalign of airway. We train everyone, we certify them, we give them an appliance. It's not $50,000, it's not $20,000. It's just a software setup fee. And basically what we're doing is our physicians love it, because when you see a patient in your office, when the dentist sees a patient and they have those things, they're snoring, they have wear, give them a damn home sleep test, right? Because what happened to me and what happened to my friend Ron is happening all the time. If you tell a patient to go do something, they're not doing it. But if you hand it to them right there, they're going to do it. And that's really the thing. And, you know, my physician and I were talking, we have a team of physicians that love what we're doing because they know their patients can't wear CPAP. It's a huge problem. So when I was asking them the other day about, like, you know, we're switching from one disposable CPAP test to another, I'm like, well, I don't know if it's going to give the same data. You know what his response was? He's like, Layne, I don't give a shit what you give them. There's a billion people walking around undiagnosed. You just got to treat them. Right. And that's what we're doing. And that's the opportunity that a dentist has, is you have an opportunity to help these people. Because the fact is, they're seeing the dentist more than they see their physician, right? People come in all the time to get their teeth cleaned. But I used to ask patients, when's the last time you had a physical? And they're like, I don't know, 3-4 years ago. And I'm like, all right, you got to go get a damn physical.
Right. Right. So tell me about the, I'm a big systems person, right? Huge systems person.
Yeah.
So walk me through that system a little bit. Is it like, I know sometimes people have like it's a 4-phase system, 5-phase, whatever. So tell me a little bit about that system.
So basically when you sign up with us, you get access to our library. We're going to train you pretty much in a day. Jen, who's our COO, will walk you through everything. Basically, what we do is we train you, we certify you. We have one appliance that Michael and I have tested. We're testing the elastics right now. We're getting great feedback. It's very comfortable. We're 3D printing. So really, it's 2 visits, right? And you get the patient in, you have them in the chair, you think they have an issue, right? So we're telling every single dentist and hygienist and team, take an oral health scan, right? Whether you have a Medit scanner, an iTero, or a 3Shape, scan every single patient. So now you have their scan. Then you hand them a home sleep test. It gets activated. Our physician reads the home sleep test in a day. And then basically based on the prescription, they're either going to get a CPAP or an appliance. That's it. There's no secret recipe to snoring and sleep apnea, right? It's not like, oh, wait, your apnea hypopnea index was this, you're going to have this special surgery. That's it. The only 2 things that are going to mitigate symptoms are CPAP or oral appliance. And that's what we've tried to do. We've tried to simplify this whole thing. You know, we're having patients go through their medical insurance for the sleep test. It's super easy. And then the other thing we're doing for our appliance, we're telling the doctors, charge what you charge for a crown. That's it. Make it really simple. Do it fee for service, just like Invisalign. Because we have medical billing partners, but like, you know, there's a lot of obstacles and bottlenecks to that. And the fact is, you got to just treat these people. They're in your practice. I would tell you that 60 to 70% of a dental practice has an airway problem. Forget sleep apnea I don't really look at it because I don't love the metrics, but I'm talking about airway, right? And the problem is that when you hear people lecture about airway, they're like, well, if your airway is the size of a coffee straw versus a McDonald's straw, the problem is in dentistry, we're very black and white, right? We look at anatomy, but in medicine, it's gray. It's anatomy and physiology. So if I told you the coffee straw was plastic and I told you the McDonald's straw was paper, guess what? The paper straw is going to collapse a lot faster. So when I'm telling you it's not a curable thing, it's really a neuromuscular response. Like, everyone uses cone beam. So if I measure an airway on cone beam and your airway is 80 millimeters squared and my airway is 80 millimeters squared, guess what? They might react totally different.
Yeah.
It's like the analogy is basketball players, right? You look at the height of basketball players, right? You can't judge a basketball player and be like, oh, they're going to be a better basketball player if they're 6'10". Guess what? Steph Curry is the best basketball player in the NBA and he's only 6'2".
Right.
So it's really looking at multiple things. It's just a matter of our appliance is really only going to help someone.
Okay, let me ask you a question. So when we talk about implementation, and I see this with any kind of new technology, whether it's technology that people are bringing in for software or whether it's new like Invisalign, ClearCorrect, implants, airway stuff, is there's always like a adoption phase. And so what I see from teams is they have to believe in it. And so what is your message of adoption when you guys train teams? And who are you training? Because I know when I'm talking to owners of practices, is they're always like, well, how does my team get trained? How do they have that want to? Because there's a difference between a team that is able to and a team that wants to. And if there is no why, then there is no want to, because they can able to, but if they just don't care, they don't do it.
So that's a great question. So when Jen and I and Michael go, we're like, we want the whole team there, right? I want the front desk person. I want the assistant, the hygienist, the dentist, right? Because when someone walks in, I want the office manager to look at that person and be like, you know what? I think Mrs. Jones is going to have an airway problem. Because that's what I do now. I look at faces, right? For so long, I just looked at teeth. But now I look at faces. And I could show an office manager 10 pictures and they're going to know, wow, you know what? That person's going to be prone to an airway problem. The other thing that I do is I sit everyone in a circle. So when I sit everyone in a circle, someone in that circle, and a lot of those people, someone in that group, either husband, spouse, son snores or has sleep apnea, or their child, granddaughter, niece, nephew has ADD. And that's what happens. Because when I sit there, I'm never walking into an office and being like, all right, I'm going to lecture you guys about this and we're going to implement this. And guess what? There's going to be all this other paperwork. First of all, there's no paperwork. It's just a matter of you sit down and you talk to everyone in the office. Because I'm telling you, I did this yesterday. I went to my friend's office. It's my best friend from dental school. He's been poo-pooing this for years. I sat with this front desk person and I'm like, all right, tell me if you have someone that you know snore. I'm 50% of the population snore. So that's all of a sudden, and now everyone was there. Once I showed him the video of Finding Connor Deegan, it's about a kid with oppositional defiant disorder and ADD. Guess what? It's like, oh my God, my son wet the bed, kind of had all these cognitive issues, behavior issues, defiant. So that's what I do. When I go into an office, I want it to resonate with everyone there. And the fact is, Anthony, it's going to pretty much resonate with so many of those people. Now it's just a matter of, conveying the message to the team and saying, you know what, we just really want to help our patients, right? We want to help our patients and we really want to help them feel better, perform better at work and sleep better. That's
awesome. So the first part is adoption. You go in there, you give them the why. Here's the reason why we're doing because, and I think you've said this before, and I've heard other people see it, is once you've seen something, you can't unsee it. Right now,
FedEx logo, man. Every time I lecture, I put the FedEx logo up. Think about it. Between the E and the X is a white arrow. All I see when I see the FedEx logo is a white arrow. So that's what I'm selling office managers, assistants, hygienists. You see someone that doesn't have a chin, I'm telling you they have an airway problem. You see wear on teeth, airway problem. right? Because we were taught in dental school, well, you clench and grind from stress. Well, you know what? It's stress from suffocating.
Right.
Right? When you go into fight or flight, the analogy I use is either you've choked on something, you get sucked under the water on the beach, or the cops pull you over for speeding, right? What do? Your heart starts racing, your blood pressure goes up, and you feel crappy. Well, think about it. If you have an airway problem and you go to sleep, that can happen 200 times a night. That's why on those patients that passed away, my friends, they had an airway problem. It puts so much stress on their heart. Now, obviously, at the time, I didn't know it. And I would have been a lot more adamant now versus then about kind of getting them treated.
Right, right. So the impact, so, so far we've talked about the impact to the patient. What is the impact to the overall, I guess, the practice, the health of the practice?
So that's always a question, right? I mean, you're a coach and it's always like bottom line. So the expense to the dentist, it's a lab fee. That's it. It's a lab fee of like $450. A lot of the other sleep appliances are $700, $800. And really, it's 2 visits. Because we're 3D printing, we're using a great material. There's really no adjustments. The only people that I'm really adjusting are people with like veneers or crowns that are conscious of like having something tight on their teeth. Right. So, when I'm telling a dentist, I mean, you would know this better, but I always say I guess it's either 3 or 4 times your lab fee, right? Okay. What's kind of a good metric for that?
Yeah, that sounds fair. Yep.
So, it's not like, I'm in Manhattan, so I know dentists that charge like $4,000, $5,000, $6,000 for sleep appliances.
Right.
We're telling you, whatever you charge for a crown, because this is the easiest procedure you're going to do. It's easier than clear aligners. It's easier than really making a night guard because there's not a lot of adjustments. Right. It's way easier than doing a crown. So that's really it. There's, the only thing is the upfront cost of setting up the software, which is maybe $3,000.
Okay.
And that's it.
Okay. And then the training and everything along comes with it.
Yeah. It's, Anthony, here's the deal. There's some amazing lecturers on airway and I've done them all, right? I've trained with Jamison Spencer. I went to Tufts. I've learned from Michael Gelb. The fact is, it doesn't matter who's talking about it. It's all the same thing. Right. So what I was seeing was there's not a lot of people doing sleep appliances. And the fact is, when I go to talk to dentists, a lot of them are intimidated by it. And, when I always say it's like, I've gone through COIS and I've gone through all this continuing ed and I lecture to these groups, I want to go to the 99%. Like I was just at the dental sleep meeting. That's not where I want to go, right? Because those are all the people that are already doing it, which is, to be honest, not that many. I want to go to the other 160,000 dentists that aren't doing this and telling them that if you're making a night guard for a patient that are clenching and grinding, those people have an airway problem. It's really simple. If you're making a night guard for a patient, the person has an airway problem. Okay. It's just a matter of looking at it differently and treating it differently.
Okay. Yeah. And so it sounds like to me, when you say you're speaking to the 99%, there's a quote that I picked up somewhere and I can't remember what it is, but it is complexity is the enemy of execution. And so
I love that quote.
Yeah. So when we over-educate or we put, if there is 37 steps of implementation, it makes the implementation too confusing. And it also makes it so that our team gets confused. And whenever there is confusion, there's chaos, right? So what happens, so what I'm hearing is that you take this big idea with sleep and all the different things out there, you funnel it down to something very simple, which creates clarity. And once we have clarity, then we have very good power, very good focus, and then we can maximize results. That's what I think I'm hearing.
Absolutely. And it's a multifactorial problem. Before we jumped on, I had a phone call from a cardiologist, very good friend of mine, whose dad has sleep apnea. It's like, Layne, my dad's not going to wear his CPAP. We got to get him an appliance. I said, and the first thing I always say is, Dan, did you check his nose? right? Because it's a multiple factors, right? It's nasal patency, it's soft tissue, it's anatomy. I obviously went into ortho for the anatomical part, but the more I'm seeing it now, I can't cure it in adults, but I could help someone function better. So what Michael and Jen and I have done is we've kind of taken, to your point, the complex thing and really kind of dumbed it down to be like, this is what the things that you see, right? I just told the dentists that are potentially watching this, if you see wear on anterior teeth, wear on posterior teeth, cross bites, high vaulted palate, the person probably has an airway problem.
Right.
I'm not saying everyone has sleep apnea. I'm saying they have an airway problem. And that's the questions I always say. Are you aware that you snore? Could you be more refreshed? And that's what our message is like, just help these people.
Okay.
Right? If you're making a night guard, don't make an upper night guard that's potentially going to close someone's airway. It's going to take up tongue space. Just make it a little differently. And that's what I learned from Michael, right? Like, not that I poo-pooed what Michael did, Gelb, but I didn't know. And when I reached out to Michael, I saw what he does. Him and his father were the only people to ever talk about repositioning. So what they've done is they've taken people that their jaws are back and they bring them down and forward. Well, you know what? They realized Michael's dad stumbled upon kind of treating airway. He opened up people's airways. They slept better. And then Michael took it to another level. And now him and I have taken what their intellectual property is and now created this amazing new appliance.
Awesome. Okay. Now what I want to do is you have, you've showed me, like you actually have like a check it out type meeting, right? And I think that's like 30 minutes or something like that. How long do you usually set those for?
Yeah, nothing more than that. You know, Jen sets it up and it's an intro and it's just talking kind of like you and I are talking about, you know, these are the things you're seeing. This is what the program entails. We also do case reviews once a month. So, you know, we have about 50 docs that are signed up with us that are just awesome, whether they're super experienced or real novice. And it's a lot of hand holding. So what we do is every one Friday a month, we have case reviews. So we'll take a case, whether it's an ortho case, a TMJ case, or a restorative case, and it's someone that has an airway problem, and we'll walk through their photos, their sleep tests, their diagnosis, and their treatment plan. And it's great for us too, right? This is a never-ending journey for me because I learned so much from all of our clients, right? I'm never going to be up there. I listen to a lot of entrepreneur podcasts, and, you know, Guy Raz is someone that I really listen to. And I listened to Adam Grant, you know, Think Again. Yeah. And he brought up something great. He's like, you know, you have these entrepreneurs that think like, well, if their thing doesn't work, it's someone else's fault. Well, you know what? We're on our 10th iteration of our appliance because we're trying to get it better and better. It still could be better, but, you know, I think we have something great. And we get great feedback from all of our docs. Because, like, I'll tell them, I'm like, email me or text me when you put it in if there's any issues, because it's the only way for me to really learn and for us to kind of, you know, resolve the mistakes that we're making.
So from what I understand is what you were saying that because you see this as almost like a mission and a forum for, or more or less like a bigger group of a mastermind around sleep. And so you're all learning from each other and you guys are facilitating the learning while making improvements on the sleep appliance as often as you see necessary. And there's something about that because I read in a book the other day, and I can't remember where I got it, which book it was from, but there was somebody, it's called like the white belt mentality. And so this samurai or this black belt, whatever he was, when he died, he asked to be able to be buried with his white belt on him, as opposed to his black belt. And they're like, why did he want to be buried with his white belt? He said, because if he ever admitted he had something mastered, then he admitted he had nothing to learn. And so what I think you're coming across is you guys are saying, listen, we're in this with you. We're in the trenches. We're learning, we're creating, we're recreating in order to get the best result that we possibly can for our clients. And although we may be a little bit further ahead or a lot further ahead than everybody else, we are humble to the fact that we are learners because it's not about us. It's about the end user and the patient and about the result that we're going to create in their life and the people that they impact. So therefore, that's where I see your humility coming from and saying, listen, if the sleep appliance has some different things that we can do to it, we're going to do to it. We're not going to say that this is it, this is perfect, and this is the way it's going to be forever. So I absolutely love that approach, and your humbleness to say, hey, we're growing and we're seeing and we're working on, because the human body is so complex in itself. Like you said, everything's a little bit different. And so for you guys to be on top of it and adjustments, and not even just that, but hands-on with everybody. So when you're saying, send me emails, let's jump on the phone, let's do a case review, let's do all these things, that's absolutely wonderful, because I think in today's age, I hear a lot of people get sold on something or sold on a system. What ends up happening is they buy it, and the service around it is promoted up here. But then what ends up happening is the service on it is actually down here. Like the email slow down, the text slow down, the phone call slow down. But you guys are so passionate because it's bigger than what you're not selling an appliance, you're selling somebody a better way of life.
Yeah, and I mean, I could tell you that obviously, you know, we're really busy and kind of we have the pillow, but Jen is like the workhorse for our group. I mean, she is on the phone all day with our clients, with our designer. Like I was just on with our designer, we're changing the attachment on our appliance, you know, because we've kind of developed this elastic, and it's great. And it's, like I said, you hit it on the head. It's a never ending journey, and we're learning. And, you know, I've learned from amazing people, right? And you want to surround yourself with great people. And I have been very fortunate to be around that. And for me, it's obviously, I went the extreme of selling my practice and going down this rabbit hole. And that's the thing that I always convey to dentists. Like, I'm a diplomat of the American Board of Dental Sleep Medicine. I went into ortho. I did this fellowship. You don't have to do those things, right? You don't have to do it because you see it every single day in your practice. It's like I said, if you see it differently, you're just going to treat it differently.
Yeah.
And I didn't. I made those mistakes for a long time, and I was kind of blinded to it until my friend Vic told me, like, all right, dude, there's something bigger than what you're seeing. And it's the same thing in medicine, right? Like, I look at a medical history now, I know someone has an airway problem, whether they're on, you know, a protein pump inhibitor like Nexium or Prilosec, or they're on multiple meds for blood pressure. So to me, it's like putting the pieces to the puzzle together, and it's just reiterating that to our docs. And for our docs to be part of it is so flattering to me. And I never take that lightly. When I get off the call with them, I'm really thankful that they, you know, are invested in Michael, myself, and Jen. And I'm so grateful for that.
Okay, I love it. Now tell me how do they schedule time with you? So what is that process? So somebody can go this video and they are saying, I want to talk to Layne in their group just to figure.
Yeah. So you could do two things. You could either go to gelbinstitute.com, or you could email me directly at lmartin@gpsfordental.com. The other thing is, if you want to give my cell number, people can text me. I'm cool with that. It's 917-748-0816. If I don't get back to you right away, I might be teaching, or, you know, I might be over at the school because I'm faculty at our program right now. But, you know, this is a journey, and I'm really humbled to kind of have amazing dentists to be part of it.
Okay.
So
yeah, I love it. I appreciate it. I can, you know, I can always see when you're starting to get a little bit more fired up again. And I appreciate your time this morning. This is something that you and I have been trying to get together for about a month or so with our calendars, and with you going all over the place and teaching and doing what you do. And then with me with the full calendar of coaching. It's just, I'm glad that we got to settle down and have this conversation to just pique the curiosity of what's possible for dental practices around the country. So I appreciate your time. And is there any last things that you want to say before we go?
the only thing I would say is, and I said it at the beginning, I am super humbled and grateful for you, right? Like I could have been practicing dentistry very differently than where I ended up. And, you know, coming from the military, I got out of the Navy with $2,020 in my bank account. It's very humbling. and you say humility, it's very important for me to never forget where I came from. It's kind of, I wear my watch from the military because it reminds me of that. But I am so grateful that I met you, because you also pushed me to another level that I didn't know I could get to. And I'm really grateful for that. And I think everything happens for a reason. And that's how the name of our appliance came to fruition, because a woman I met at Bo Easton was talking to me about Ayurveda, and she was talking to me about Vada. And I'm like, oh my God. And she's like, what? I'm like, Ayurveda. That's the name of our appliance. She's like, what do you mean? And I'm like, yeah, that's it. She's like, do you know the responsibility you're going to have? And I said, great. That's what I need. I need more pressure on top of all the other stuff I'm doing. Now you're telling me I'm going to have this, but you know what? Dude, I cannot thank you enough. I'm serious. I talk about you every time I go and lecture.
Dude, that's so awesome.
And I bring you up about kind of how engaging you are. And it's also, you know, Jen and I were talking about this, like what makes someone special is how they interact with people. And not only how they interact with people, how they make other people feel. And by you sitting in the front row at Smiles at Sea, it just wasn't me. It was everyone else on that stage, Anthony. So you're obviously, I've gotten to know you well, and you're a very special person, and I'm very appreciative that you had me.
Man, I appreciate that. All right. With that being said, I'm going to figure out, since this is our first go around, I'm going to figure out how to like repackage this thing we just did and get it out in some different areas. So we'll see how it goes. Yeah, you and me doing something new.
Cool, bud.
All right, man. You have a good day.
You too, pal.
Right.